I'm Reed Alexander for Retreat Behavioral Health. Thank you very much for joining us. It's July, it's Minority Mental Health Awareness Month, and here at Retreat, we're having serious conversations around mental health and access to care that pertain to minority groups. We're very happy to have joining us remotely today from our Retreat at South Connecticut site, Michael Briscoe. He's a clinician and an expert in social policy as it relates to mental health care. Michael, nice to see you.
Nice to see you. Nice to see you. Thank you for having me.
Yeah, we're delighted to have you. Thanks very much for joining us. So I want to dive right into the conversation, Michael. Why don't you begin by telling us how you came to the mental health care profession? I know you've had an interesting route into this industry.
Yeah, well, it started a long time ago. I kind of weaved in and out. I had a career as a firefighter, but around 25, I started my career as a drug and alcohol rehabilitative counselor for an agency right here in Connecticut. And I spent some time there. And then I worked at a halfway home doing the same kind of work for people on reentry when they were coming out of jail. And then I took a detour into public safety, still in public service, but took a detour into public safety, becoming a firefighter, ultimately becoming executive director of public safety communications for the city of New Haven. But all in between that time, I worked in and out of the field, and also continued my education to develop and train because I knew that there would be life after the fire service, and this is what I wanted to do.
Interesting. So as a Black clinician now who's had all of those experiences, you're treating minority patients. It's Minority Mental Health Awareness Month. We want to have conversations around how we can start to open up broader discussions, broader doors and pathways to treatment for minority patients and minority groups that are dealing with mental health concerns. So how do you relate to those people, and how do you start to engage minority groups, whether it's the Black community, the Hispanic community, to feel disarmed and to feel comfortable opening up to you, sometimes at their most vulnerable points, about mental health challenges? What do you say, or how do you start that conversation?
Well, the first thing I do, no matter who I'm engaging with, whether it's a minority, African American specific minority, or it doesn't matter, is I accept that person. I accept people. And so one of the things that I just make it normal. I make it normal. I don't look for somebody else to make it normal. You know what I mean? So if I'm having a conversation and mental health becomes a part of the conversation, then just like any other topic that becomes a part of the conversation, I engage. And so by doing that, I treat it with the acceptance that I also treat people with, and it just kind of makes it something possible rather than something. I mean, we can go into whether it's a stigma or not, or certain attitudes that project to it or not. If I don't feed into those themes, I don't counter transfer that attitude into those themes, then it's easier for someone to accept it as being normal, or the possibility of it being normal.
So what are those themes that you're talking about, those common themes? Are they stigma? Are they sort of cultural resistance to opening up and talking about these things that, may go back for generations? What kind of themes are you referring to specifically?
I think it's a combination of all of those things. I mean, we can talk about religion. If we look into the history of how religion impacts mental health, I'll just quote the church. The church wanted the head, right? It wanted the behavior, right? The medical doctors can have everything below the neck. But when it came to the way we behave and the rules, religiously, we want to be able to deal with that. So religiously, do we have demons? What's wrong with you? Like all of those kinds of questions. And we think we can pray a certain condition away. And in reality, it's all health, physical health and mental health, it's all health. So there's no separation in that. Another theme outside of religion may be cultural attitudes. It could be gender-based attitudes, traditional roles. I need help. What do you mean you need help? Be a man, be strong. You could deal with that. Meanwhile, the weight of whatever it is could be mounting, and our mental health could be drifting. because we're not attending to it. And then we're not open to attending to it because of what we actually think about it, because we internalize what other people thought about it. And the stigma in that regard starts to come into play.
So what do you say to people who are dealing with that in their family or who are dealing with that in their personal life, and that's all they've ever known, who may be concerned? I mean, right now, a lot of people, it's July 2020. It's a tough time in the country and the world. People are suffering. Data have shown, projections have shown, research that anxiety is rising, substance abuse relapse is a severe risk that the population is facing. So if people are watching this and culturally find barriers to entry for care that have been there for a long time and they're fearful to speak up, how do you encourage them to overcome some of those cultural barriers and be able to raise their hands safely and get help?
Well, like anything, it's the introduction, right? You can't force someone's mind to change. You have to engage, I think, at all levels of therapy. You have to engage counseling and mentoring, education. Education is huge. This is where people can realize things that maybe they haven't thought about, maybe things that they didn't know. But I think that's how you do it. And then keep it on the table. Keep the topic, keep the subject, keep it on the table. Because when you do that, again, you normalize it. You remove a lot of the barriers just because of the engagement. And before you know it, people are asking questions. Well, what's the purpose of therapy? If I go to a counselor, what should I expect? And so as you continue the conversation, what ends up happening is more and more information is shared, and then people's comfort level starts to evolve, and then they take the leap or the risk.
And they feel more comfortable confiding in you.
I think done the right way. I have to embrace the idea that mental health is healthy. It's good for you, and it's nothing wrong with it. I have to accept it myself, and making this my life and promoting it. What's my attitude towards it? Well, I welcome it. So if you talking about me personally, if I were to go into therapy, I'd go into therapy with an open mind, with an idea of developing a partnership with the therapist, bringing my issues, whatever they were, to the table, and then working with that therapist to formulate a structured treatment plan to start to help me walk back into health or mental health.
Michael, data show, I mean, listen, the data are very clear.
Mm-hmm.
Minority groups continue to have disproportionately lower access to mental health resources and support systems and communities and services than their white counterparts. The simple question is why? I mean, you've studied this, you've written about this, you've explored this research. Why do we continue to see this barrier to entry for minority groups in getting that kind of mental health care?
Is really multiplicity. The one thing that I want to focus on is that this is no different than the healthcare disparities across all health issues. And
Mm.
when you look into the data and you see that, you don't see that there's a difference here either. Um, Certain populations just don't have access, not because of any attitude either, maybe because of affordability or how one would access mental health services.
Hmm.
So if we look at, say, an affluent family or some family with a level of ability to afford mental health care, they can access it privately, so forth, so on. But then when you look at it in a lot of, let's just use urban centers for an example, with high concentrations of minorities. And here in New Haven, the average salary is 38,000. Healthcare benefits aren't always part of your benefit package. And so you don't have the ability to afford nor the resources. A lot of people are enter into the mental health through the school system, through the justice system, through punitive means, right? Something's wrong again, something's wrong with you. And so those underlying themes of how one would access mental health also help to promote not only the disparity, but the stigma and the attitude towards being receptive to it, right? So if I'm in a school setting, and a school counselor refers me to a nonprofit agency, and that's the partnership. Now I get the help that I need. But now, what did that take? That took stigmatic documentation, alienation from, say, the mainstream population in school, and then being treated differently so that I can be referred and then access the service.
So if you could leave us on a note of resolution for Minority Mental Health Awareness Month on how we're going to fix some of these problems, what would be 2 or 3 things that we as a community, as a society could start thinking about? I've heard ideas like putting counselors and social workers in schools to increase access in the inner cities and among minority groups to mental health support systems and professionals. I mean, what other ideas would you say we could be doing or looking into that might make a difference here?
I would say those things do exist in the schools already. It's the mechanism, it's how people access the service. So if we make it available for everybody, instead of, say, a child with a diagnosis, maybe they might be emotionally disturbed, an emotionally disturbed diagnosis where they need now an IEP. If we took that process out of it and allowed people who felt like they needed it, them and their families, to access it in school, now you have the services available, but then you have a different way or a different mechanism of how we move into service.
Yeah. And finally, your message to people watching this who may be in need of help and support right now, a sort of a hopeful message for our viewers. What would you say to them this month?
Well, what I would say to them this month, this month is, I guess, Mental Health Awareness Month, and we need to make it more of a lifestyle, a year, a ongoing conversation. And so, take the education, ask the questions, be open to the information, because in any moment, it's just like when we call 911 and we know we need a certain kind of care, a certain kind of help. It's okay to say, okay, I've been kind of feeling low. My moods have been low. This sounds like what I've heard about depression. Well, let me see if I can access a care line and maybe get some help for that. Some information, maybe a referral. Start to, I think, care about yourself enough to know that it's just another way to be well, right? We go to annual physicals, we get annual physicals. If something's wrong, we have a certain kind of cough, we go to your doctor for it, right? It's okay. And that's the message that I want to leave, that it's okay. Okay.
That's a good message. Michael Briscoe, nice to see you. Thanks so much for speaking with us this month.
Thank you. Thanks for having me.
And I want to remind everybody, you can find more resources and support this month at www.retreatbehavioralhealth.com or on social media as we continue to honor and recognize Minority Mental Health Awareness Month. I'm Reed Alexander. Thanks for joining us.